I think it's neat you brought a board member with you today.
Yeah.
And I wonder if she would be comfortable sharing with us, what has it been like for you being on the board?
Well, I guess I can stand up, and I'm not usually a public speaker, but when I first came to know CHAS was 2013, right when, we opened a few months, and I was underinsured. I had student health insurance, I was a student at the time, and I became very ill and didn't know. I mean, I'd always been healthy. I didn't care about getting, much coverage for insurance. I was happy with, I never got sick. My husband had his private insurance, and so I got sick. And things started happening that I, couldn't understand. I mean, more things than a person could go through. And so I heard about CHAS, and they got me in within a month. I had to wait a month, but I already knew, I was like, well, this is gonna cost. I mean, I'm gonna go in and they're gonna refer me out and there's something really terrible wrong. I got there and I was welcomed with open arms for one. Not one mention of how are you gonna pay me. Come in, let us care for you. And I ended up having a brain tumor. And there's a story that goes before that. My doctor at the time didn't tell me I had it. And I could only assume it was because I was underinsured. Well, we're just gonna watch it and, and get, we'll send her on and so I just, so the CHAS really, they did, you see the commercials, they saved my life. And fortunately, my husband had a retirement and I was able to get good doctors in Seattle, and the CHAS actually hooked me up with that, and I was quite scared to actually continue seeking health care here in the community because I wasn't told about my brain tumor. And so for the past few years I've been going to Seattle. Without retirement now, we're pretty broke, but I think that with the help of the CHAS, and now being on the board has opened my eyes to I can still trust there's hope, that there are people like you, the individuals here in CHAS that are willing to help in any way they can. And as far as pharmaceutical, I have a medication that I have to take for the rest of my life, $550 a month. They're helping me right now seek help trying to pay some of that. So it's kind of with the different services that are pointed out, and it's just been overall. It's just been great. I mean, I can't say enough about. I wish you guys hired a welcomer or a hugger or something, because that's the way it is. You're welcome. Yeah, I'm a hugger. And being on the board has been, I never thought in the world, and I have a minor in psych, and sociology will be my major once this ticker's healthier. Actually in the fall I will start that and go immediately into my master's. So hopefully, it's just helped me all the way around, and not just me, but many of other people, hundreds of other people. And so I don't have enough good things to say. I mean, they're just, it's the same every time you go in. You're treated the same. You're treated no matter what. So that's my story, and I hope that they can continue, because health insurance in the state of Idaho with the Medicaid expansion is uncertain. We go every year and hear, okay, we're going to come up with something, and then they're like, well, time's up. Didn't come up with anything, so that's why we only have 8%. And I fall in that gap. I'm now following that gap. I don't qualify for Medicaid, but can't quite, afford private or health Obamacare. Or as you would say, ACA, I would rather say than Obamacare.
Yeah.
But, so we'll keep fighting and keep moving on to keep things.
Well, I just want to say that was perfect timing, because if I remember correctly, the legislators are coming next week.
Mm-hmm.
And so if you are concerned, that would be a good time to be here and ask them those questions and put them on the spot.
I missed out on going to speak with Aaron in February because of the weather. My flight was canceled, so I was gonna go and pull some people in and, yeah, so maybe, you know, next time, there will be many other opportunities, but we, as CHAS, I say we, appreciate any help and your guidance and just telling everyone about us and yeah.
You're a beautiful speaker. Keep speaking.
Well, you know what, I used to cut classes, or drop classes because I was afraid to get up to speed in front of everyone. I did many of classes, and so, now it's like, since everything has happened and I built my confidence back up, and CHAS is really, I can't, but, I think that I won't cut another class, drop another class because I have to speak. I think that, I fear nothing now. You know, brain tumor, well, you know, I mean, nothing can, you know, nothing's gonna get me down now, but, I'm long-term care. I'm gonna need long-term care for the rest of my life. And I think that, CHAS would be a big part of that. And so, yeah, anyway, yeah.
I just want to echo what Joan said, because our legislators are going to be here next Wednesday at noon. And I think us saying something is nothing compared to the story you just shared. That is just, that's the stories they need to
I
hear.
thought I was in it all alone, you know, I thought I'm by myself and then there's so many other stories and so many other people that, man, you know, I love life, that's for sure now, I gotta tell you. I loved it before, but now, you know, and as you can hear, I'm not I've lived here for about 22, 23 years, I think, and, but I'm a native Texan, I've lived here about 25, so, but, I can't say enough about the support and the just the goodness that the CHAS brings out. Yeah. So if you ever do hire a hugger, hopefully when I get my degree, I'll be a part of that. So,
Thank you.
thank you.
Are there any other questions?
So what's the dynamic with working with the Recovery Center, Lakeside Recovery Center and CHAS?
You know, we try to make sure they have our brochures, and Daryl knows he can send people down. So that's, we kind of work together, and I chuckled, I used to make sure I went down there like once a week, but this winter, when the weather was so terrible, I just saw RJ the other day, and I said, I am so sorry. I said that to get down there all winter has just been
The
hard.
sidewalks go both directions, by the way.
Yeah. So we try to make sure that they have, you know, brochures, and he knows he can refer people up and stuff. So we try to work that way together. So, and I imagine he just built a new little meeting room, so he'll probably have me come down and do something, or have one of our counselors come down and do something, because we talk about that all the time. So, yeah.
Not much time, but I assume that you have data that shows that preventative care saves money. You implied that.
Oh, yes,
You implied that
yes,
earlier.
we do. And you know what, we have what are called UDS measures that are standards of care within CHAS and the federal government. We're always working in our guide teams and our Q. We have a quality improvement coach, and she's always working with us to work on getting those wellness measures or UDS measures up. So yes, we do follow that very closely. We have a it's called a quality management tab in our EHR, that every time you come in, it wants us to talk to you about smoking. When was your last mammogram? When was your last physical? I think it's your Tdap, your pneumonia. I think there's about 25 things on there that every time you come in, somebody's reviewing that, going, oh, you know, we need to do this, we need to do that. Very important.
I would say if we can just leave you guys with one thing. We're all a little mixed up on the slides, but, you know, definitely if you guys could help us on the advocacy side of things, that would be really helpful to our patients. The other ask is just getting back to our workforce. If you know of anyone who's consider it, who are, maybe lives here or maybe is interested in moving back to this area. We're always looking for primary care providers, dentists, and definitely those support staff. We need dental assistants, dental hygienists, so feel free to send those referrals, contact Amy.
If there's a acute need for advocacy, you might let somebody in lead know so that a message can go out to all of us.
Yes,
Somebody.
Do you know how many dental hygienist schools there are in Idaho?
I think I want to say there's, is there two? I want to say there's one in Rexford, is it Rexford?
I just know we work closely with Lewis Park.
Lewis Park, yeah, and LCSC, Lewis Park has one.
He's called Talent Center.
I think there is one.
And they both have your plea for,
Yeah, our
Your
recruitment
graduates
does a
come-
lot of outreach to get staff, it's just, it's such a challenge. Even medical assistants is a challenge when we have a really good group of medical assistants right now, but it is a challenge to recruit medical assistants even. And LCSC has a program, and so does Walla Walla, but I went to a job fair and the gentleman at LCSC says that all of their medical assistants go to Seattle. Which I thought was interesting, I'm like, oh, because I was like, why? We have such a hard time, and he thought, well, most of them are in Seattle.
But the salaries are competitive.
Yeah, the salaries are very competitive here, yeah.
What about WAMI students? Do you have WAMI students? that are working with you?
Our providers will typically take one. We did not take one the last semester because of our move. We were in the little crowd space and we moved, and it was such a challenge. The move was a huge impact, so we didn't have one this past semester, but we will come fall again. So, yeah.
Thank you so much for.
Thank you.